Okay, let's talk about lymph nodes. You've probably noticed lymph nodes before. Some of us have lymph nodes that are pretty close to the surface. And so when we get pathogenic infections, respiratory infections, we can feel them sometimes here, sometimes here. I'll show you a couple of them. So what lymph nodes are doing is as lymph is moving through the vessels, they are monitoring and removing germs from lymph. And when they do that, they're also activating or initiating the immune system response if it's necessary. So they're like killing things off, but then also preparing for the next time. So let's look at the structure of a lymph node and let's look at the principal groups of lymph nodes first. So there are the submandibular lymph nodes, and they're along the inferior border of the mandible, and they kind of monitor lymph from the lips, nose, gum, anterior portion of the tongue. Then there are the cervical lymph nodes that are in your neck, right? So submandibular are here and cervical are here. It's a large group of lymph nodes that are in your neck. They monitor lymph from the head and neck. So it's coming down and going through these. There are the axillary lymph nodes here. Axillary lymph nodes are deep within the armpit, and they monitor lymph that's coming from the upper extremity, also the breast region. And then there are inguinal lymph nodes right here. Then they're in the inguinal region in the groin. They monitor lymph from the lower extremity primarily, also the genitals. And then there's a whole bunch of other lymph nodes just sort of scattered throughout the body that don't have like specific names. And they are going to sort of be clustered at areas where invasions might occur, like the skin, digestive tract. These are not the same as MALT, because MALT is like in the epithelial tissue or deep to the epithelial tissue of the digestive tract. These would be lumps that were near that, but not in that tissue. The urogenital tract, the respiratory tract, the same thing. Okay, so let's introduce you to the structure of a lymph node. So let's just take one of these lymph nodes and actually look at it close up. So I want to take like one of these inguinal lymph nodes and look at it close up. Come on. Okay, so here is a lymph node. First thing I want you to know is that you look at the lymph node and you see these repeating structures, which are those lymphatic nodules. So those are kind of how you form almost all of your lymphatic tissue. And remember again that when you look at a lymphatic nodule, you are going to see T cells around the outside and B cells and macrophages in the middle. Okay, so what is going to happen with these? Oh, let me change the lymph node because that one's going top to bottom. Let's make this a cervical lymph node. So what's going to be happening with the cervical lymph node is I am going to be putting fluid in it, lymph fluid in it, from multiple lymph vessels or lymphatic vessels. So the fluid is going to be coming down through these cervical lymph nodes, okay? And these little guys vary in size quite a bit. They're usually oval or kind of bean-shaped, and they're located along the lymph vessel. So if this were a lymph vessel, I might have a lymph node here, a lymph node here, and a lymph node here. And they range really dramatically in size, and they're not really very consistent from person to person, from like pinpoint size to up to an inch. And their job, again, is to monitor that lymph that I picked up, that fluid that I picked up, for potential pathogens. Okay, so I'm monitoring the lymph for potential pathogens. So let's look at a few parts. This little indent is called the hilum. We see that all over the place. We see it with the kidneys. We see it with the ovaries. Now here it is with the lymph. This is where a vessel leaves. Then I've got the capsule around the outside, which is basically connective tissue. And then I have the cortex of the lymph node and the medulla of the lymph node. So it's kind of like the same pattern that you see with the kidney and with the ovary. So what is going to happen is as I bring fluid in through these vessels, and these vessels are going to be called afferent lymphatic vessels, the fluid is going to go from the cortex by all of these lymphatic nodules. Okay, bring the fluid by. Lymphatic nodules are looking at it to see if there's any antigens in it. And then it slowly percolates through this little guy here because it's pretty low pressure, so it's going pretty slowly. and then it's going to go out the efferent lymphatic vessel. So as it goes through, so how the flow works is it comes in the afferent vessels, and they bring the fluid into the lymph node where it slowly moves from cortex to medulla. There's macrophages in there that if anything is alive, they will whoop up on it because they're just the meatheads of the immune system. And then remove foreign bodies, kill anything that's in there, and then send lymph out the efferent vessel. Did I say these were efferent? These are afferent vessels. This is an efferent vessel. And it's going to leave at the hilum. And then this one is, of course, going to ultimately go to the next lymph node. So hopefully you are seeing that there's a heck of a lot of redundancy in the immune system, because now I've showed you that you have malt, which might meet and respond to a pathogen. You have tonsils, which might meet and respond to a pathogen. You have lymph nodes, which might meet and respond to a pathogen. And then we're going to see the spleen, which might meet and respond to a pathogen. We've got all of this redundancy in our immune system so that hopefully if a pathogen gets in, we will find it and launch a response to it. So if the lymphocyte, the B cells and T cells, if they detected a foreign antigen as the lymph went by, the response would begin. And the response would be B cells, T cells activate, T cells start bossing B cells around, B cells will make antibodies to whoop up on whatever specific pathogen was there. Macrophages just kill anything that looks weird. And then those new B cells, T cells, macrophages, and antibodies will actually get dumped into the efferent vessel. And then the efferent vessel, again, eventually will dump into your subclavian veins. So eventually whatever you met anywhere in the body is going to make it back into your bloodstream and start circulating. So you are going to circulate B cells, T cells, and antibodies, and more macrophages after you have met a pathogen. Okay, so let's make a couple of clinical connections before we leave this topic. So one of the things that's important clinically is that because the whole lymphatic system is really, really good at just picking up anything, because they're so open, right? They'll just pick up any damn thing. They'll pick up whole cells really easily. That's great when you're launching an immune system response. It's not really great when you actually have cancer in your body, because they will pick up cancer cells and they will motivate those cancer cells to go to other places in the body. When they do that, it is one of the major sources of metastasis in cancer. So you can follow the route of your lymphatic vessels to look at common routes of metastasis. That's why, for instance, when someone has breast cancer, and they have a mastectomy, they don't just usually remove the breast tissue, they also usually remove the lymph nodes and lymphatic tissue around the breast tissue in case one of those cancer cells metastasized into the lymphatic system. So they remove that as well. Now, although many of us will not get cancer, a lot of us will have swollen lymph nodes at times. And a swollen lymph node occurs when you've got a whole bunch of activity in a specific lymph node. So it gets a big swollen lymph node because there's a whole bunch of pathogens, and the lymph node is going through a hell of a lot of cell division and antibody production and all of that kind of stuff. So when that occurs, the node can become enlarged and tender. Sometimes a little bit painful. That is called lymphadenopathy. Lymphadenopathy. This big swollen lymph node is actually called a bubo, and that is where the term bubonic plague came from, because one of the ways that you could tell that somebody had bubonic plague is that they had big swollen buboes. So it's not always a symptom of plague. It's a symptom of infection, any kind of infection. Also, swollen buboes can also be a symptom of cancer, but the cancerous ones don't usually hurt. Then talked about removal of breast and axillary lymph nodes. When you remove lymphatic vessels and lymph nodes, you a lot of times get swelling or edema, and that's just because the fluid that was moving up here has lost one of its roots. You will reconnect those the lymph vessels eventually, but until then, sometimes if someone has a mastectomy and they have the lymphatic vessels and lymph nodes removed during that process, you get swelling associated with that limb, and sometimes they use compression garments to help to get rid of the swelling. Eventually, it will generally repair itself. Okay, and then what if you get sort of a chronic swelling associated? So this you can see stage 1, stage 2, stage 3, stage 4. This is called lymphedema. When something is impeding the flow of lymph back, so you can see how it's developing in the leg and it's impeding the flow of lymph back into the cardiovascular system. Sometimes damage to your lymphatic system or a blockage in your lymphatic system can cause this, which is lymphedema. Now, an extreme case of lymphedema is what we call elephantiasis. This is not like the elephant man. This is a parasitic infection that actually blocks your lymphatic vessels, and so the fluid gets trapped. So I'll show you some elephantiasis. So here is elephantiasis that you can see, okay? Elephantiasis is caused by a worm that is parasitic and infectious and carried from one person to the other in the larval stage through biting flies. I don't think it's mosquitoes. I actually forgot just for a minute, but I think it's biting flies. And so if I have it and the eggs or larvae are in my bloodstream, then biting me and then biting you can transmit it from one person to the next. Now, the later stages, the larval stage of its life form, will actually insist inside your lymphatic vessels, and they'll block the drainage through your lymphatic vessels. So it commonly occurs in the inguinal region. Sometimes it can occur in the axillary region. It can occur almost anywhere, but those two are really common places. And then this one is transmitted through most of a whole village. It's a historical photo that shows you lymphedema and elephantiasis of the testes in multiple men in an area. And then this one is elephantiasis of the lower limb. So that's elephantiasis. It's treatable. But a lot of these pictures were before treatment was available or before this person sought out treatment. Okay, so I'll stop there and I'll do the spleen and the thymus in the next one.